Okay, so bleaching agents take the color out of the surface cells, but they don't necessarily solve the problem as to why you have the dark spots in the first place. Okay? The skin doesn't really care what causes the inflammation, it's how the skin responds to the inflammation. Right? Every dark discoloration has an underlying cause of inflammation. You must identify the source of inflammation to eliminate future darkness. Now, what areas have chronic darkness? Dark circles under the eyes, okay? Which is different from a dark spot from a pimple. But any dark spot can be permanently eliminated with the flawless compound, because the compound goes through the skin and turns down the cells that actually make the color, okay? So what kind of conditions have we treated with the flawless compound? Without question, the most popular is blemishes from previous acne. Compound works in the skin, not on the skin. You'd be less likely to get a pimple. If you get a pimple, it'll be less severe, and it gets rid of the scars and dark spots from previous pimples. Dark circles under the eyes. Now, there's some ethnic variance in terms of what causes dark circles under the eyes. Currently, it's believed that people of European descent is caused by broken vessels. In black women, it's caused by problems with the underlying sinuses. Now, we have to clear the sinuses first. We use something called Asian ear candling to decompress the sinuses. So no drugs, no chemicals, no harsh agents. And most people can feel the difference not after the procedure, during the procedure. They use a hollow candle, they insert it into the ear canal. There's no wax, no dripping, no fear or concern of getting burned. When they light that candle, it creates a vacuum. All the passages of the skull and face are interconnected, and it pulls the debris into the candle, okay? I taught anatomy, I didn't believe it. My first session, I sat in and I photographed it. During the session, the patient started to swallow. And she said, Dr. Tinsley, I can feel stuff coming up the back of my throat. Ladies and gentlemen, stuff doesn't come up the back of your throat, stuff goes down the back of your throat. She can literally feel it pulling. Now, the interesting thing is for the non-believers is once they're done, if you have dark circles under the eyes, trouble on aircraft, frequent sinus infection, you should definitely try Asian ear candling. And at the end of the procedure, and the procedure ends when the smoke is clear. What do I mean by that? When they first light the candle, if you have a lot of debris, the smoke is black. Then it turns gray, then it turns white, then it gets wispy. And when it gets wispy, they put the candle out. Ask them to cut the candle open so you can see what came out of you. And it's not wax. And people feel relief immediately. So I strongly recommend Asian ear candling as the first step at eliminating dark circles under the eyes, particularly if you have trouble with your sinuses, regardless of your ethnic background. Surgical scars can be treated. Any dark discoloration can be treated with this compound. And also, regardless of how old the dark spot is. We actually have an East Indian doctor who ultimately collaborated with me on a book who had a dark spot that was a birth defect, right? And he came to me in his 20s and we got rid of it, right? The melanocytes control the color. If you control the melanocytes, you control the color. The flawless compound does not work on the skin, it works in the skin. So typically, we'll give a patient our cleansing souffle to wash the face with. That's preparing the skin for the compound. The souffle removes the day's debris, all the oil, and the normal acid mantle so the compound can get in. Any other questions about anything? You looking curious?
So as far as keloids, oddly enough, I'm a keloid former, and I had an operation 6 years ago, and so I have like a 9-inch scar on my stomach, and I also have keloids wrapped around my intestines, extra scar tissue wrapped around. So I know that she was talking about, or somebody was talking about the keloid on their wrist. Is there anything you can do about like internal scar tissue that's, you know?
Okay, some of you may or may not know the plastic surgery textbook titled Ethnic Considerations in Plastic Surgery. The chapter on keloids, I actually wrote that chapter. Keloids can be managed. Oftentimes, keloids cannot be surgically removed, only managed, and in many cases they can actually be eliminated. That would require an evaluation. Internal scar is an adhesion but not actually a keloid. One of the things about medical training in terms of this specialized area of healing, not every doctor gets this particular training. This came from specific training outside of medical school. What does that mean? That means a lot of professionals, including doctors, call ugly scars keloids. A lot of doctors and other professionals call complicated scars keloids, but they are not keloids per se. A keloid, by definition, invades the normal surrounding tissue. All right? If you have a thickened scar in a surgical incision or a surgical scar that's healed and is thick, but it stays in that line, that's a hypertrophic scar. All right? A keloid will move out that line and cross your hand. Okay? So imagine if that happened with the intestines. Right, there will be zero success. Okay? Those internal scars, which can be very dense as a matter of fact, are called adhesions. Okay? And they tend not to be aggressive. However, if you have a band and there's moving intestines, sometimes the intestines can get stuck between the bands, and that can become a surgical emergency. But fortunately, real keloids do not occur inside the abdomen. There's never been a keloid of the lower eyelid. There's never been a keloid of a testicle, ever, in the history of modern science. Do we know why? No, we don't. And the problem with solving the keloid problem is only humans get keloids. There's no existing animal model for keloids. Rats don't get them, monkeys don't get them, no other living thing on earth gets keloids, only humans. So that kind of makes it difficult to study. Any other questions? Yes, ma'am.
As far as the scar treatment you just spoke of, how long does it take for that treatment to be successful?
Okay, so the question was about how long does it take to see a significant difference in a scar, a blemish, acne, any of these skin conditions that we treat. Ms. Robinson alluded to it earlier, okay? If you come to my office, if you inbox me on Facebook, if you email me, if you call me on the phone, if you got a carrier pigeon, my answer is going to always be the same. I ask everybody 2 questions. 100% of the time, I ask everybody 2 questions. What's the first question, Ms. Phillips?
How much water do you drink?
How much water do you drink a day? The second question, Ms. Phillips?
How many bowel movements per week?
Exactly. Believe it or not, the condition of the colon has a lot to do with the condition of the skin. So in the flawless skin protocol, step number 1 is water. Step number 2, condition of the colon. Step number 3, products. And step number 4, services, in that order. I know oftentimes we go to the department store, to a doctor's office, and we say, I have this issue. The first thing they want to do is give you something. You cannot possibly have flawless, beautiful skin unless you first have healthy skin. Healthy skin does not start with a fancy doctor. It does not start with an expensive product. It starts on the inside. You got to drink your water. On the topic of water, there's a lot of confusion out here, okay? A lot of confusion out here. There's an equation for water consumption, and most people believe it's half their body weight in ounces. In actuality, it is not, okay? I know you heard it. You might be a personal trainer yourself. You might be an exercise physiologist, and I know you've heard this before. The equation is half your lean body weight in ounces. So you have to know your percent body fat, subtract that from the total to determine your lean mass, and then half of that you should consume in water. So since most adults have trouble with fractions, let's stick to 64 ounces a day. The average water bottle is 16 ounces, so you need just 4 bottles of water a day. So the second step is the colon cleanse or the detox, if necessary, okay? Women have the highest rate of constipation in America. So we always ask women, how many bowel movements do you have a week, okay? So on the intake form, it says, do you have a history of chronic constipation? And the women always check no. But when we meet with them and we ask, how many bowel movements do you have a week? About 70% of the people that come to see us have 7 or less. 7 or less, by definition, is constipation. But in America, because we call 1 a day regular, we think 1 a day is normal, and it isn't. You should have a bowel movement with each meal, all right? Believe it or not, each meal. Now, all these women who are married or otherwise live with men may have noticed that they have more bowel movements than you do. A lot of women think the man is abnormal, when in fact, that is normal to have a bowel movement with each meal. So step number 1 is water. We won't even let you do our detox if you're not well hydrated. It takes the body about 3 weeks to get used to the water. So it takes about 3 weeks to get hydrated. What does that mean? 3 weeks, you're going to urinate a lot. After 3 weeks, the opposite happens. Your body gets used to being well hydrated and you get thirsty real easy. Then the second step is the detox, which is 30 days. Then the products, then the services. A lot of patients will come to us and they want microdermabrasion, they want a facial, they want a chemical peel, but they're drinking 8 ounces of water a day and having 3 bowel movements a week, all right? And the staff will intervene and say, listen, you should see Dr. Tinsley and get on the program. The nice thing about the program is the results can be permanent. Now, to answer your question, if you're doing the water and your colon's in good shape and you start the product, you should see a significant difference in 30 days, okay? I'm not talking about, I think it's better. Do you think it's better? It should be like, wow, Dr. Tinsley, okay? And that's what we should expect. Any other questions?
On the same line with that, I know I went to one of your seminars that you talked about clean colon.
Oh, yeah. Right. Now, I don't have a healthy diet, okay? I'll be the first to admit that I don't have a healthy diet. What do I mean by that? I pretty much will eat whatever you give me, okay? If you give me something healthy, I'm going to eat it, all right? If you give me something unhealthy, I'm going to eat it. So what I lack is called dietary discretion, okay? Now, having said that, you may have noticed, I may have a little bit of a pot belly, but not a whole lot. You may have some friends or associates who are vegans or vegetarians, but they still got a pot belly. What is the issue there? This is a very important point. A clean colon and a dirty diet is much better than a clean diet and a dirty colon, okay? If you eat fruits and vegetables 3 times a day, right, and you're having 3 bowel movements a week, the omnivore that's eating fried chicken at McDonald's 3 times a day, that's having 3 bowel movements a day, is actually better off. Okay? If you're accumulating toxins in your colon, there's nothing you can put in your mouth worse than what's already sitting in your system. And that's why we put such an emphasis on the condition of the colon in our skincare program. You're going to sleep better, you're going to feel better, you have more energy, and many people have resisted doing a detox because of their history with detoxes. Our program is unique. It cleanses the colon and it strengthens the colon. And people feel good. And I've gotten many a hug and many a kiss from people who've been on this detox, who were non-believers initially. It does work and it does make a difference.